Good morning. It's Thursday, October 15th, the middle of October. A little chilly out there. We're glad you're with us, and this is The Doctor is In. Ask Dr. Arwady. It's your chance to ask questions to Dr. Arwady and get the latest on COVID-19 here in Chicago. I'm Sybil Madison, your Deputy Mayor for Education and Human Services, and I'm here with Dr. Allison Arwady, your Commissioner for the Chicago Department of Public Health.
Good morning. Thanks for joining.
If you have questions for us, put them in the box below. You can also use Facebook or Twitter and the hashtag AskDrArwady to send us questions, and we will get into those after a little bit of an update.
We will.
On our data and
check our social distance.
Our social distance, which is looking good. All right, Dr. Arwady.
All right, sounds good. So let's jump right into the numbers, because I imagine a lot of you who are taking the time to join us on Facebook are also watching our data. And I imagine you have concern, as we do, about the ways that we are seeing our numbers increase here in Chicago. So I want to have a chance to talk about that in some detail, and maybe we'll speak some more about it. I imagine folks will have questions. So as always, chicago.gov/coronavirus is your one-stop shop for everything related to COVID here in Chicago. Right up at the top is the latest data tab. You can look at the dashboard, you can look at hospitalizations, you can look at static reports. There's all kinds of things that are up there. You can also get directly to the dashboard on chi.gov/COVID-. And if we pull this up here, first of all, let's start with the number that is concerning us the most, which is our daily case 7-day rolling average, which today is at 442 cases per day. And if we look, a week ago, we were in the lower 300s. We were at 335 a week ago, which means we've seen a 32% increase in 1 week related to cases. And that is of grave concern. Some of this increase is due to an increase in testing. If we look at our testing numbers here, we are averaging the highest we've ever averaged for tests at 10,558. And you can see on the graph here, that really has been shooting up for the last month. But if we compare that to a week ago, we're up 16% in testing from a week ago. So the bottom line is we're up 16% in testing, but we're up 32% in cases. And so that tells us that only half, if that, it is not all explained by an increase in testing, although that is in part impacting it. The other thing that we look at is, of course, our positivity rate. This is the test positivity rate. As a reminder, this is just where you take on a given day. We average over 7 days the average number of tests that are positive in a given day. That 442, we divide it by the number of tests that are done, on average in that same week, and we are at 4.5% today. And that is below that 5% cutoff. That is our place we most want to be. You'll recall that all summer we were having trouble getting that positivity below 5%. 5% is a standard, across the country, across the world, for where you absolutely want to keep your positivity under. And so I'm glad that it is under 5% at 4.5. But if you look, a week ago, it was at 4.2%. And although the difference between 4.2 and 4.5 is not huge, testing is going up. And so what we would want to be seeing is that as testing is going up, remember our denominator is number of tests, we want to see positivity coming down. So the problem here is that, yes, we are doing more testing, and that is good, and that is progress, and I expect to see that continue to increase. We are also breaking records every day with the number of people who are getting tested at the City of Chicago sponsored sites. Yes. And that is also good news, because those, of course, are in parts of the city where we most want to drive testing. But nevertheless, we are seeing real increases here. On the plus side, as much as there is a plus side, is that at this point, we have not seen this rise in cases impact our hospitalizations, our emergency department visits, or our deaths. And if we look at the demographics maybe real quickly, I think we should, just to get a sense of what is potentially driving this. So I'm going to break it down by race, ethnicity here for starters, and I'll just pull it into the last couple of months so we can zoom in. If you see how I'm doing this on the dashboard, you can explore yourself. So if we just take it to the last 2 months, and I'll blow it up so you can see it. So these are our daily case rates for race ethnicity. Blue here are Latinx Chicagoans. Red are white non-Latinx. Purple are black non-Latinx. Asian are, green is Asian non-Latinx. Yellow are people who report other race ethnicity but non-Latinx. And what you can see is that really just over this last week in particular, we've seen big increases across every race ethnicity group. The Latinx numbers are actually a little lower still than they were back in late August. We'd seen some really good improvement, it's not that this is sort of concentrated in one race or ethnic group.
Right.
Similarly,
kind of all going up in the same way.
Kind of all going up in the same way, exactly. And if we look at age here, also I'll just show for the last month or last couple months, and we'll bring it here. Look at this. Pretty much all of the all of the age groups are also increasing really pretty significantly over this last week. On the top there in red, that's our 18 to 29-year-olds staying on top, followed by our 30 to 39-year-olds, our 40 to 49-year-olds. Like the pattern here has not changed. Down, you want to be at the bottom down here. So I'm glad to see that our 80 plus and our 70 plus are staying lower, although there is some increase even in the 70 plus. Our kids also are remaining lower here. The blue is the 0 to 17-year-olds. But broadly speaking, there's not one age group that is sort of driving this particularly. And where we look at our patterns of geography across the city, I'll go back to the dashboard here. What we see is that still we're predominantly seeing a focus in the same areas where we have. On the southwest side in particular, I'll just pull up the map. This, for example, is cases and case rate in the most recent week. So where are we seeing the most cases? In the southwest here, in the northwest, very similar to what we've been seeing all along. If we look at rates, which is where you correct for population, still you see that the focus predominantly is in the southwest, the northwest, a little bit more on the southeast. And if we look at positivity, it's sort of the same. We are seeing cases from every single zip code. We are seeing increases across really all of the zip codes. And unfortunately, what we're seeing is also what we're seeing across the state, across the country, and even across the world. So there are significant surges in COVID in the Midwest. There's big surges in Illinois. Illinois, if you look at our numbers here in Chicago, I'm very concerned about seeing a number that's in the 400 range. But if we look back to May, we were seeing more than 1,000 cases. So we're, a little bit under half of what we were at our worst here in Chicago. Illinois as a whole is actually above now what we were as a state back in May. And so I have real concern about that. Even
so as a region, we're doing a little bit better, but
Chicago is doing a little better than downstate Illinois.
Yeah.
Illinois is doing a little better than, Wisconsin, et cetera. But broadly, COVID is not going well, is the bottom line.
Yeah.
And, even in Europe, some of this is about as the weather's getting colder and people are moving indoors, the number of cases per 100,000 are higher right now in France, in Spain, in the UK than they are in the US. And we had seen such good control in that setting, and they're having to really put more restrictions in place there, some of the restrictions we've really had to have all along here. Yeah. So the news is not good.
What should we be doing? I mean, we don't want to sit and just say,
that's right.
This is the fall surge that everybody was talking about, right? We want to actually
We do.
Fight against this?
And the bottom line, and we've talked a little bit about this, is that I think people are getting COVID fatigue. I think this is real, that people are feeling like they are tired of wearing their masks and they're tired about social distancing. They're often letting their guard down, especially when they're gathering with people sort of in their households and their friends and family. And, I've seen this a little bit just out and about myself in Chicago. I'll be interested if people have comments or questions or ideas sort of about how to combat COVID fatigue. But I want to be clear that we are not seeing, there's not a huge outbreak with hundreds of cases somewhere that is driving this. Right. This really is.
It seems to be a population.
It is a population moving in this direction. And certainly if we have, I'm very concerned about what this has the potential to lead to related to some of the more severe outcomes. Yes, we're detecting more, and that is good, but it is not the full story. And I am hopeful that we'll be able to keep our levels of hospitalizations and deaths, down. They remain sort of at those historic lows, and some of that is because of the change in the age, right? The fact that early on, our 70 plus and 80 plus year olds in particular were having very, very high rates of COVID. We're not seeing that at this point, and that's part of why I think we've not seen those really severe outcomes to date. But
I know that this feels a little like a somber conversation, but we should be very proud of ourselves that we have, for the most part, protected at least the elderly among us who are more vulnerable.
Yes, that's been going well to date. Of course, my worry is that as we see more and more people with COVID, younger people interact with older people.
Yes.
And so, a reminder to everybody, obviously do the things that we're always exhorting you to do, but also, it's getting to be a more dangerous time for COVID, which means it is not the time to be relaxing those behaviors. And particularly if you have somebody in your household or somebody in your bubble who has an underlying condition or who is older, who's over 60, you need to be especially careful. And, we're going to be having conversations coming up here, I'm sure, about things like the holidays. This is not the year to have your traditional large Thanksgiving gathering, and
nor to travel,
right? I was on a national call, and there's a big worries that, you think about college kids who potentially, we've seen a lot of outbreaks in college campuses, traveling across the country, bringing COVID. This is not a good time right now from a COVID perspective, by and large.
I'm curious.
Yes.
Maybe this is one of the questions in the chat box. I don't know. Do you think we're going to get to a point where we actually should be masking indoors as well as outdoors?
Well, so it's already a requirement, as you know, to mask indoors in any sort of public gathering space.
in our social, personal.
Precisely.
Yes.
I just wanted to be clear about that for everybody. Yeah, I really think that if you are gathering, and let me tell you, if I am going into somebody's home, I've been really careful sort of here in Chicago that if I am getting together with people, that has been outside, really on my back deck. And if I am in somebody's home that is not my own, if people are coming into my home, wearing the mask is one of the easiest things that you can do to keep that higher level of protection up. So yeah, I think if you're going newly into somebody's home that you're not already in the bubble, or you've got folks coming in, it is good etiquette to be encouraging that mask use. And if you've got an underlying condition or somebody who's older, this is not a selfish thing to ask. I know it can be a harder conversation, but I've been pleased to see, my own friends be very clear about, if I'm having people over, we're going to be outside, it's going to be limited to this many people, if there will not be masks, it's because we will be outside with this distance. You can't come closer than that. And if you're not comfortable with that, you're not invited to my home right now.
Yeah.
And I think, that's what I want to see in terms of people really being very careful, and particularly indoors.
Yeah. All right. It reminds me, too, of the responsibility that we carry, because our coworkers are in our bubble, and we're all essential workers. And so getting back to that bubble thinking and really thinking about who's in your bubble and tightening that up. Maybe retracting a little bit with your bubble.
If there are things you can dial back on right now, if there are things that you're doing that are not essential, if there are interactions that you're having with folks who are not in your household, in your close bubble already, now is a good time to be dialing back on some of those activities. We've learned a lot about how to keep workplaces safer. We've learned a lot about how to keep congregate settings safer. And I know that when people are abiding by these broadly, we're not seeing big outbreaks in that setting. But when you let your guard down, you let COVID in potentially.
Yeah. Okay. I know that you started talking this week about a new metric. We've been talking about all these different, the rolling case rate, the rolling death rate, positivity. but I know you introduced the reproduction number.
We did.
Which, Throwback Thursday, we did used to talk about when we were back in stay at home.
We did.
I don't know if you want to share anything about that today before we dig into more questions.
And I know we've gotten some questions even just since we sort of shared that publicly. So I think it's a good thing to talk about. I can actually, I did bring a couple of the slides that we had showed at the press conference, maybe to talk through in a little more detail. So do we have those up here? Good. Let me make it so we can actually go to a slideshow view here so everybody can see, maybe. Oh. View. All right. You know what? We're not going to worry about it. Okay. There we go. So, so the bottom line, this reproduction number, and some of you who have been following along with us all along know that this is something we've talked about at least a little bit, but we are introducing this. Oh, good. Someone's going to come and actually fix it so everybody can see. Oh, now everybody can see. Okay, great. So the reproduction number is this concept that is used in a lot of settings. This is actually one of the main metrics that they've been using a lot in Europe, and it's a number that epidemiologists follow all the time, but it pulls in a lot of different data sources. So it recognizes, for example, that things like hospitalizations and deaths have been more stably counted all along. We've not missed we've missed a lot of people who have had COVID, right? Yes. We estimate that at least 5, and my feeling is probably 6 to 7 times as many people in Chicago have had COVID as have had a positive test. And although as we test more, that may decrease a little bit, we know that that's not been a particularly stable number. Mm-hmm. Whereas we've had actually very good testing access from really early on for people who were sick enough to be hospitalized. And we've had good access through the medical examiner and others if people have died, to make sure that we are not missing a lot of people who would be hospitalized with COVID, And so this is sort of a model and a way of pulling in a number of these different metrics to get a sense of, is your outbreak expanding or contracting, and how does this fit in? So this reproduction number, or R it's sometimes called, you might have heard R naught. R naught is the term that's used before there have been like any mitigation strategies in place. It's the sort of how the virus would behave
in the wild.
In the wild, basically, exactly. In a theoretical sense, when people are just meeting.
So we're beyond R naught.
We're at RT, which is the R at a particular time. Okay. As in, like, with the mitigation strategies that we have in place now, what is our reproduction number? And so the basic idea is that the R is the average number of people who are infected by each person with COVID-19 in Chicago. Yeah. All right? So if your R is 2, the idea is that each person who has COVID, so here on the left, we've got this red person who is coughing with COVID, spreading it to 2 other people. And that doesn't sound bad, right? Like one person spreading to 2 other people, that doesn't sound like something that would drive a huge outbreak. This isn't one person spreading to 100 people like we've occasionally seen in super spreaders. But the problem is that if you, across the outbreak, have a reproduction number of 2, these 2 people go on to spread it to 2 other people, who go on to spread it to 2 other people, to go on to spread it to 2 other people.
And that's when the exponential
that is an
impact.
Exponential growth. Basically, it's right. It's a very steep growth that will very quickly push your outbreak out of control. Whereas if you can get your RT to 1 or even below, if you have an RT of 1, that means your outbreak is essentially flat. Each person here spreads to an average of 1 person, spreads to an average of 1 person, spreads to an average of 1 person. And so what we had showed was that the higher that your RT is above 1, the faster COVID will spread. We're not feeling good broadly when it is above 1, and the higher it gets above 1, the more concern we have. If RT is below 1, it means infections are slowing. And our modelers and our folks who have looked at this here in Chicago have estimated that very early in our outbreak, our RT in Chicago was estimated at about 3.6, 3.62. So each person with COVID-19, way back at the beginning, was spreading disease to between between 3 and 4 other people on average. That's why our cases were shooting up so quickly. And you remember all this talk about successfully flattening the curve.
Yes.
The way we did that was by changing the conditions to make it harder for the virus to reproduce, literally bringing down the reproduction number. We successfully got RT down to under 1. The lowest that we saw was about 0.85. That's good. That means that there are people, many people who are infected but not spreading the disease at all. And you know, that's all of the things, the staying at home, the masking, the social distancing, the hand washing, all of those impact the ability of the virus to spread sort of at the population level. And our current RT in Chicago, calculated sort of earlier this week, was just over 1 at 1.013. You know, I will be very interested with this rise in cases. Obviously, we'll see how this hits hospitalizations. We'll be keeping a really close eye on this, but you can see on this graph here with the models, this is fitted to our hospitalizations, our intensive care admissions, our deaths. Like, it's fitted to actual Chicago data. And the blue here represents sort of the range that we sort of could be in. And then the dark blue is the estimate. And so you can see that, you know, during the very, you know, when we were under the strict stay at home, that under that setting, when there was very little interaction going on, that we got that RT all the way down to 0.85. And then as we...
So our lowest point was before we started to slowly reopen.
Yeah, that's right. Our lowest points were back in sort of May, right? And at our peak here. And then as, you know, we expect this, as we reopen as a society, you do see that sort of come back up. There's more opportunities for spread, but we've been relatively stable here. You can see sort of through July and August. We saw some of this rise in August, which we were concerned about, seeing that in the case numbers too, coming back down in September, you know, just a little bit, but basically right around this sort of 1 number. And what we will be watching really closely is to see, does this also start to take off? Because this is a way sort of behind the scenes that you're able to pull in a lot of your factors and understanding what's happening with your outbreak by and large.
So we talked a little bit about fatigue at the top, and I know that COVID is completely new and it's not that old.
Right.
So it's hard to know how it actually, you know, moves. But do you think there's a likelihood that we would be in this kind of rolling, you know, versus a, is that the rhythm? And I'm not saying that we want that rhythm,
right.
But
so at some level, this is the rhythm, right? The rhythm of seeing the virus look. The virus doesn't care. The virus just is looking for opportunities to spread. And when it gets an opportunity to spread, it will spread. And as we see more spread, you know, it has the potential to really get out of control. As you can see,
so it's not the virus's rhythm, it's our rhythm.
It's our rhythm. It's our rhythm, right, exactly. It's not that the virus is changing or becoming more infectious. You know, there's a ton of work happening. We've not seen major mutations in the virus that make it sort of more spreading or more dangerous by and large. It's that we give it more opportunities for it to spread. And so
is this, like, I'm a psychologist by training.
Yeah.
So the rhythm could be fatigue related, which is that we have our guard up, then we kind of let it down, then we see the numbers, this biofeedback kind of thing, and then we clamp down again, but then we...
Yes, exactly. And I cannot say strongly enough that the way we win COVID is people's individual behavioral decisions. It's important that we put the structures in place around making sure that our public spaces are as safe as they can be. And we've done a lot of that. I think we've done a good job of that by and large here in Chicago, really removing a lot of the very highest risk settings. We've been able to keep those in good control. Broadly, our businesses, our public spaces have good things in place, even where, you know, we've got schools that are open here and they have been going well in terms of really being able to keep down major risks of spread.
It's the non-regulated aspects of our lives.
Regulated aspects of our lives, because, you know, I think it's human nature that, you worry more when you are in a setting that doesn't feel safe. And so I hear a lot of people being very worried about being on the CTA. When you're on the CTA, there's a lot of people around you you don't know, and you do obviously want to be careful whenever you're in a setting where people don't know. But let me tell you, people are careful about wearing their masks and washing their hands and keeping their distance. They're thinking about COVID when they're traveling, and we've not seen COVID, we've not seen public transit here or in other places around the world actually be a significant spread in the way that perhaps people had theorized that it might be. I think that's because people are especially careful because they're thinking about it. Whereas when you're getting together and you're meeting and you're feeling safe, I was talking to some of my colleagues around the country, and people are seeing spread. They're not in these huge gatherings so much. It's like the spread are people getting together with 4 people and 6 people and playing Monopoly and having dinner.
Think about all of the protesting that was happening, and
not seeing major.
Everybody was worried that that was going to lead to.
That's right. We did not see major spread related to that. People were A, outside, B, especially here in Chicago, doing a good job of masking up and trying to be careful. And, we did emphasize really strongly protecting folks who are older. If people were protesting or doing some of these, that is a riskier activity. There's no way around it. But I think we had some good testing and people generally trying to be careful that if this was something they were going to do, they needed to be careful in other areas of their lives. But you're going to be thinking about risk when you go into a situation that you perceive to be risky, and it's these individual level things that's not. So, I think the other piece of this is that there are folks who I think have let down their guard because they've had COVID. There are people who, at this point, about 3%, 3.2% of Chicago has officially been diagnosed with COVID that are in our numbers here. I know that number is 5, 6, 7 times that. So probably, somewhere in the 15 to 20% range of Chicago has probably had COVID at this point. But what can't be said strongly enough is that there are so many unknowns about how long that level of immunity will last, particularly people who had a mild infection. CDC says for the first 3 months, there's probably some level of protection. We have seen, it is possible, although it does not happen often, we have seen examples of people being reinfected with COVID. We've talked about that previously. But more than that, we don't know how long this lasts, how good it is, and we need people, even if you've had COVID, to be doing the masking, to be doing the social distancing.
They have to do the same thing.
They have to do the same things,
All right, okay. That was a lot.
That was a lot. That was a lot.
Let's get into some questions here. Angela Louise from Facebook. Why do we use the number of positive cases as a metric? If it takes 7 to 9 days for results, those people are usually no longer contagious anymore. Shouldn't we base it off of hospital stays?
Okay, so good question. There's a number of questions in that. So first, let me be very clear that it does not take 7 to 9 days to get a test result back at this point.
It shouldn't.
It shouldn't, right. If you are getting tested in a setting where it's taking to 7 to 9 days, that is not okay. We follow very closely what it's called our turnaround time. How long does it take for when tests are being done to when they're coming back? And as we're starting to see some more rapid tests, I mean, there are turnaround times that are literally in the order of minutes. But even in the traditional setting, most of this turnaround time that we're seeing is within 1 to 2 days at this point. It's very unusual to be seeing tests coming back 5, 7, 9 days. Some of that was true months ago, but it is not true now, thank goodness. And as we continue to build additional sort of testing capacity and lab capacity, one of the reasons we've pushed to try to do a lot of that, even while things were in somewhat better control here, is because if we are seeing a surge, what I don't want to see is the turnaround times be going up dramatically. And we saw that in the South, where they were having a big surge. Some of the big lab, especially the send-out labs, were having problems with turnaround times. It's not something we broadly have a problem with here in Chicago right now, and very much as capacity has grown, that should not be a significant problem. But the second part of the question was about shouldn't we look at hospitalizations, right? And this is why we absolutely do look at hospitalizations. And this is not, people always want to know sort of, is there one number to follow? Is there one thing to follow? And
they want the magic metric.
They want the magic metric. And you actually do need to look at all of these metrics and pull them together. That RT, one of the reasons we're introducing it is it's one of the best metrics that actually pulls all of this data in together and is more at a high level, how is our outbreak going? But regardless, the number of cases is absolutely important because that is how we are able to understand, how much COVID is there here in Chicago. The percent, we look at the cases also as compared to the percent positivity and the amount of testing performed. But it's not that any of these is more or less important. They just help us know different things. And we use this data. I want people to understand this to drive the response. It's not like we just say, oh, like these numbers are bad. We say, where are the numbers bad? Where do we need to push additional resources, whether that's testing or outreach or making sure there's opportunities for, whatever the needs may be. How do we perhaps shift messaging so that, because it is true that we see different demographics and we see different risk factors. We were looking at sort of a smaller hotspot on the near north side where more than a third of the people with COVID reported travel outside Illinois in the last 14 days. We look at it down on the southwest side, only 4 or 5% of those people are reporting travel, but they're reporting much more sort of within home spread. And so there's high level messages for the city and then targeted messaging around what we're seeing with a different age group or with in a different area. And so we try to sort of focus on this and use this as a place for intervention. Anywhere where we see points of concern, we do additional enforcement. In terms of businesses, we work to keep the settings that are of high concern in control. But yeah, we look at hospitalizations too, for sure. Yeah. And actually, we're doing a redo of our dashboard, by the way, with just wanting to pull in some of the different ways we look at positivity, wanting to actually pull this RT in. And I've asked them to actually pull some of the hospitalization data in as well so that you can find it all, but it's in a few different places. And I want to make sure we continue to be very transparent and let people know exactly what is happening with COVID here in Chicago in a way that's easy to see.
All right. Lori Holmbaum from Facebook, what are harmful effects of wearing masks for long periods of time? Any harmful effects?
No, there's no harmful effects of wearing a mask. So I know that this is something people have been concerned about because we've gotten questions about it. And there have been theories out there around ideas that, for example, if you wear a mask for a long time, it will drop your oxygen level in some way, or it will make your carbon dioxide level go up. And I want to be very clear that neither of those things are true. If you're really interested, you can even Google. There's some really nice YouTube videos that people have shown, running with oxygen monitors on and masks, really showing you do not have a drop in your oxygen level from wearing a mask like this. It does not happen, and you do not have an increase in your carbon dioxide level either. Where I think about sort of, quote, long-term effects of wearing masks, certainly, I have a lot of friends, of course, who are healthcare workers who are wearing masks the entire shifts that they are going.
Yeah.
And we talk about
fitted masks.
Those are the fitted masks, so those are sort of even more on. And people definitely will get you can have skin irritation potentially. We see more acne, maskne, right? If people are not washing masks, this would be for the general public. Like if you're not washing your mask, you may have some sort of more potential skin irritation. I know that it is not always completely comfortable for people, and so I encourage, if it's hurting your ears, we've talked about this in the past, there's ways you can put it on a headband, there's ways that you can sort of attach it to other things to try to make it more comfortable, but there is no danger to wearing a mask in terms of things like oxygen or carbon dioxide. I also sometimes see misinformation that the mask will somehow give you COVID. It will not, and yes, we want you wearing your masks, but the most important thing is that you're wearing them. So if you've got a follow-up, if that didn't answer your specific question, go ahead and let us know. But the masks themselves, what they are doing is mainly protecting people around you, as a reminder, which is why we need everybody to wear them. They do a very good job in terms of really limiting the amount of COVID that has the potential to come out of your mouth. And remember, the whole reason why we had to move to universal masking is that there is a period of a couple of days before people get COVID symptoms where they are very infectious with COVID and can be spreading it. And if you're not wearing a mask at that time, we've seen the potential for a lot of transmission.
Okay. Speaking of masks, Rebecca Flores has a question about a study. The CDC recently released a study that 85% of people who have contracted COVID-19 regularly wore masks. We know that masks help slow the spread of the virus, so what are we supposed to make of this study? Are you aware of this study, Dr. already?
So I don't know exactly which study that is. There are some, there have been a lot of different studies, and sometimes people will pull portions of a study or kind of reported on a particular way. So if you want to put a link in, we will definitely take a look and be able to comment on that particular part. But what I can say is that based on sort of our local evidence here, particularly where we've seen some of these larger outbreaks, and we're going in and really doing what's called a case control study, where you actually interview people who were in a space who got COVID and who didn't, and do some comparison between them. It's a good way of understanding what are risk factors for COVID, et cetera. We have clearly seen that wearing masks is protective behavior. And even though the mask is mostly about protecting others, I do think people who wear masks in general are being more careful about COVID in a lot of ways, so it's an indirect there. And so, for example, we had a pretty significant outbreak here related to sort of a gym setting where a lot of people were getting together and exercising indoors and wanting to be healthy, but were not wearing masks, many of them, in that indoor setting. And we saw a lot of spread in that situation. But the people who were wearing the masks were actually quite a bit less likely to get COVID than the ones who were not. I mean, that's sort of an anecdotal thing. But what we have seen, and we've shown on here, and we could bring some of it up again maybe in future days, is how significantly wearing that cloth face covering is in terms of reducing the amount of virus that potentially comes from your mouth. It's there have been really good studies that have looked at population levels of countries, et cetera, that where you see good mask adherence, you see less spread of COVID. So I would be interested in what you're referring to. So if you want to put it in, we'll take a look and be able to address the specific piece that you're referring to. But I want to be very clear that the recommendations are strong and consistent across all public health leadership, that wearing a mask is one of the safest and most important things that you can do, in conjunction with keeping your distance, in conjunction with hand washing, in conjunction with these other things.
Yeah, and we've seen the opposite, right? Where places that don't have universal masking or strict masking
have seen big increases. Yeah.
Okay, Jean Brooks from Facebook. This kind of touches on, you made a comment about mutations earlier. I read yesterday that the virus has mutated slightly to be more infectious, but also less lethal. Any truth to that? I know it has become more infectious, but what about the lethality?
All right, so I love it when we get to talk about this sort of detail. So there continues to be, in the same way that there's a huge body of work happening around the science of vaccine development and around treatment development, there is a very large body of work around both what makes an individual more likely to get seriously ill from COVID, right? Because this remains, there are individual differences here. We know at a high level having the underlying diseases, et cetera, and being older, but getting some more nuance in that will be helpful. And there's some very interesting work on the individual level about what makes someone more likely to be a, quote, super spreader, right? If we could really get a handle on that, is it just luck? Is it that somebody is, out and in a setting where they're not masking and they're with a lot of people and they're shouting and singing or exercising, things that especially sort of have extra virus coming out? We have seen big super spreading events in that setting, but is there also something about the person, the biology that may have something to do with that, right? That would be extremely helpful. We're looking at some of our contact tracing even. There's a really interesting article, if anyone's interested, from The Atlantic last week that was comparing sort of R, which, now we've introduced R, to, there's another variable that we use called called K, which is it's called dispersion, and it's about how much variability is there within R. So even if overall, on average, people are spreading to 1 or 2 people, we know there are some people who spread to a lot of people, and many people, most people, even with COVID, don't spread to anybody. And can we get a handle on why that dispersion is so different? Because we're really interested, of course, from a control factor in controlling any super spreading event. So anyway, all to say, there's work in terms of the human host piece, and then finally there's work on the virus itself. And big databases around the world gathering the actual genetic fingerprint of the virus, the RNA itself. That is how we're able to look for mutations and then be able to compare and see, are there different sort of strains emerging. The good news at this point is that, and I was glad to see he said it's sort of a minor mutation, is that we've not seen at this point major changes in the virus that, for example, would be likely to impact vaccine production in serious ways. So flu, we have a whole bunch of different strains of flu, and there's a lot. Every year you got to make a new vaccine because there's so many different types. COVID.
We're still not seeing that with COVID.
We're not seeing a lot of genetic sort of drift or spread, which is good news. Some of that, in my opinion, is because the whole world has been susceptible, so there's not been a lot of pressure at this point on the virus. The virus has not needed to mutate because it's had all kinds of opportunities.
Successful.
It's been very successful.
Why change?
Why change? Exactly. We've not had a lot of successful drugs that have been developed. Drugs often. This is where you talk about like multi-drug resistant tuberculosis or HIV or antibiotic drug resistant. That's because the microbe mutates to sort of get around the virus, get around the drug. We've not had a lot of pressure, if you know what I mean, on the virus. So it's not had a whole lot of need to mutate. So at this point, I don't think there are major, and again, I love this sort of back and forth. If somebody wants to send a particular article, we'll look at it and comment on it next week. But there's not been, at least here in the US, I think major changes in terms of how the virus itself is behaving. To your earlier point, it really, I think this surge is more about the change in our population behavior than it is major changes in the virus. But certainly—
So you wouldn't say that it's more infectious?
Well, there's debate about this. I think there's not really a full strain yet, right? Like we sort of talk about there's like, again, strain kind of has one term in the scientific and one in the general term. But if we use the general term, there's been sort of a strain that emerged in Europe that there's some theory maybe somewhat more infectious. But my sense from doing the reading at this point is that it is less about major changes in the virus and more about the behavioral stuff. But send us that link if you want. And I really like this question, so I'll pull up before we come back, and we'll do an update on what do we know about changes in the virus, because it's interesting, and there are folks on who want to talk about it. So I love that.
Yeah, great question, Jean. I could see that Dr. Arwady was getting into her Science Saturday mode. Yep. All right, Queen Linda Clark. Queen Linda from Facebook. How do you keep the workplace safer after someone at work has tested positive?
All right. So we have a lot of experience with this. And we have experience with this, at the health department, we have individuals test positive at work, just as businesses do across the whole city. And so there's a few sort of best practices that and if you're interested, you can go to the website and you can see what they are. First is a notification system that protects the privacy of the individual. I cannot emphasize this enough. You may not sort of say, Allison has COVID. Like, beware. Like, no. You have to have a notification that protects the privacy of the individual. And that also means not saying, not just Allison, but like, the person who is the commissioner at the health department, the person who has this job. Like, you do have to protect the person's privacy in any kind of notification. But
by law, you have to protect their privacy. By law, you have to notify other employees as well?
So there, this gets tricky. Yeah,
okay.
there's not a law around notification, but it is a best practice. We have put out best practices. We also think that having best practices, the law is that if you have 2 cases in a work setting, you have to let the health department know, because we then will sort of do some follow-up and make sure things are in place, et cetera. So there's the law is around the requirement of an employer to report to the health department, because we will get involved, particularly if we think there's a level of concern there. It worries us a little bit when employers want to sort of play health department actually around some of these privacy issues and others, so that's why it's part of it. But it is a best practice to make people aware. Largely because it helps remind people that COVID is very much here and around us in Chicago. So, we send out, just to give you a sense at the health department, a notification across the entire department every time someone has been diagnosed with COVID. The only information that we provide is their work location and the last day they were at work. In many cases, we do that notification even for people who have been working remotely, right? We have actually plenty of people who have been diagnosed with COVID who have not even been physically at work, but nevertheless we share it. And again, I think it just helps make the point that there is COVID, we have to be careful. And then we have, again, a investigation that protects privacy where we are doing sort of the individual case investigation and contact tracing, and the health department can help employers with that if that is necessary. But from a cleaning perspective, so first of all, if you're doing all of the right things from the get-go, you should not have a high risk for COVID spread, even if you have an employee with COVID. This is what we have seen in workplaces broadly, even in the schools that are open broadly. Our average number of cases that gets reported out of these is 1. Right? There's a case. You have to do the right thing. Sometimes you have to quarantine people who have been in close contact. If they've been within that 6 feet, particularly if they weren't wearing a mask for more than 15 minutes, there may need to be a quarantine. Like, we want to follow all of these appropriate practices. But in most of these cases, we actually don't see further spread, which is a good thing. You do want to make sure that there's been a good cleaning that's done. But as a reminder, this does not require, another good thing about COVID is that it is killed by the traditional cleaning supplies, and you don't
I know a lot of times people were saying deep cleaning and all that.
Yeah, I mean, deep cleaning to me means doing an extra careful clean. It means going in and making sure that the high touch surfaces, those are the ones we're most concerned about, the doorknobs, anything where a lot of people are touching surfaces. You want to make sure those have had a good cleaning, potentially exactly where that person has been. You might do an extra level of cleaning there. But remember that fomites, which is the kind of spread where you're touching surfaces and then potentially touching your own eyes, nose, mouth, that has not been as significant a source of spread as the interaction with the living, breathing human has. So we do that cleaning, and that cleaning should happen. But more important is understanding what the risk factors have been if people have been, have had those exposures, particularly if they've not been keeping their distance. Now, if your workplace is set up appropriately, people are keeping their distance, people are wearing their masks, the risk should actually be fairly low, and that is what we see in the great majority of cases.
Got it. Interesting. I think it's about time for us to turn to good news. But you were saying in these settings that have reopened, we're seeing just maybe 1 case. Just bringing it back to the top. And I know this is probably not the right application of this, but the RT then in those settings is not higher than we would want it to be.
That's right. Okay. That's right. Exactly. And that, we really, it's been interesting to me actually how much progress we've been able to make with some of these basic mitigation things. If everybody's wearing their mask and everybody's keeping their distance and you've got good hygiene things in practice, we've actually broadly been able to sort of keep this virus in reasonable control. It doesn't mean that there are not going to be cases, because there are, but we've not seen the sort of out of control spread like we were seeing early on. We were seeing, some of these large workplaces, the jail, the long-term care facilities, the homeless shelters, high risk settings, big outbreaks. our percent positivity where we're testing in these congregate settings, which we are, is like 1% at this point. And we investigate hard wherever there are cases. And, I don't want to imply that there's not any risk there, because there still is some level of risk. But we've learned an awful lot about how to keep spaces relatively safe. And this shift of being much more worried about spread in individual sort of private interactions is on the one hand, it shows some progress and success in the kind of in our ability to have good things in place in the public setting, but we don't regulate private settings, and we shouldn't regulate private settings. And so, we've dropped, the modelers estimate that we've dropped the risk 88% here in Chicago. From, at the beginning, if you used to have one person who has COVID interacting with one person who does not have COVID, the chance that COVID will spread with all the things that we're doing across the whole city has dropped by 88%. And that is better than we were predicting in any of those early models, right? I was talking to the Argonne modelers, for example, just last week, and we were saying, why have things been sort of to date here a little better maybe than we had been anticipating? And it's all because that risk of spread and interaction, we've managed to drop that quite a bit. But the problem is, if people let up on this, they get COVID fatigue, that starts to slip just a little bit, and we see cases potentially really shoot up. And, I am worried that this could be the beginning of this second surge that everybody has been talking about. And we are watching carefully to see what continues, but I think especially the fact that we are seeing it in such a widespread way across the city, across the state, across the region, across the country, even across, in some ways the world. This could be what folks have been concerned about. And now is the time to double down on the things that have helped keep this in control broadly to date.
Okay. Any good news?
Some good news. Yes. We all need good news like today. Okay, well, one piece of sort of good news / reminder for everybody is that today is your absolute last day for the census. If you've been following the news, there's been different lawsuits about when does it end and when does it not end. Today, across the whole country, not just here in Chicago, if you did not fill your census out, if you know anybody who did not fill their census out, please, please, please go to my2020census.gov and do it. We've only had 60% of Chicago fill out the census, approximately. And we're
going to feel the impact.
We're going to feel the impact. We lose $1,400 for every person who does not fill out the census here in Chicago. That's the money we need for our schools, our roads, and everything. It's also how we get represented. Like, we have the potential to sort of lose national representation. And as the health department, these are the statistics that we use. Not only, we get a lot of funding directly based on our population, but these are also the stats that we use to understand disease patterns in Chicago. So please.
A lot of public funding is tied.
A lot of public funding is riding on this, and it takes less than 10 minutes. So
if you live in Chicago and you have not filled it out,
if you live anywhere in the U.S., fill it out. But especially if you live in Chicago, and post about this, call people. If this is literally the last chance to do it today. So that's really my one main announcement in terms of things you should do. There is also a press conference today at 3:30. We're doing with the Mexican consulate. So and a number of the other consulates are coming together. Obviously, we've continued to have a focus on the Latinx community here in Chicago, and so if you're interested, you can tune in for that. We'll be talking some more details related to that community. I'll be part of that. Next Tuesday, we are actually not doing Facebook Live because there are a lot of things happening related to budget preparation and scheduling. So we won't be on next Tuesday. We probably will do some filming of the shorter one-off questions, so you can keep putting questions in and send us things. And if we didn't get to your question today, or if you want to send us links of articles you want me to be able to comment on, I love doing that. Thank you, as always, for joining. Now now is the time to get even more serious. I feel like I say this all the time, but really for real, the way these numbers are looking.
This is the city that bent the curve.
This is the city, we've done it before.
We know what to do.
We can do it again.
We just have to keep doing it.
Absolutely, absolutely. So thanks so much for joining.
Be safe, Chicago.